everyone, we're nursing students from Sacred Heart University, and this is the Self-Measured Blood Pressure program. So this is session 1, and today we're going to be talking about blood pressure classifications and the importance of blood pressure control. So when you have your blood pressure taken, you're going to get back 2 numbers. The first number in your blood pressure reading is called the systolic blood pressure, and that is the amount of force that your heart is using to pump blood through your arteries. The second number is called your diastolic blood pressure, which is measuring the pressure of blood flowing through your arteries. So a normal or healthy blood pressure should be less than 120/80. So anything above that is going to be considered elevated. So high blood pressure or hypertension is also known as the silent killer because high blood pressure often has no symptoms, so it's very important to monitor it.
Alright, so let's discuss blood pressure further. So when blood pressure is measured, it's measuring how much pressure your blood is putting on your arteries. So think of it like a garden hose. The force that the water puts on the walls of the hose is like the force the blood is putting on the artery walls. When the blood pressure is increased, it takes a toll on the artery wall. Too much pressure over a long period of time can cause the artery wall to weaken and become damaged.
So there are many causes of high blood pressure. Some of these causes are things that we can change and others are not. So some of the things that we can change are diabetes, unhealthy diet that has an increased use of salt, physical inactivity, obesity, excessive alcohol use, and tobacco use. But some things that we cannot change are our genetics, increasing age, and race.
Alright, so discussing the stages of blood pressure, we can see how a normal blood pressure, as stated above, is the top number being less than 120 and the bottom number being less than 80. An elevated blood pressure is the top number being 120 to 129 and the bottom number being less than 80. Stage 1 is classified as the top number being 130 to 139 and the bottom number being 80 to 89. Stage 2 is classified as the top number being 140 or higher and the bottom number being 90 or higher. And a crisis is classified as the top number being higher than 180 and the bottom number being higher than 120.
So as we mentioned earlier, when your blood pressure is uncontrolled for a long period of time, it can have some complications. So some of those complications for your health can include stroke, vision loss, heart failure, heart attack, kidney disease, and sexual dysfunction.
So let's discuss an overview of the treatment, which includes medications, diet, and physical activity. So lifestyle changes will include eating a healthier diet with less salt, as well as exercising. Medications include diuretics, beta blockers, ACE inhibitors, and many more that will be discussed in later sessions.
So that's it for session 1, so we'll see you next time for session 2, where we're going to talk about the self-measurement of blood pressure. Bye.
Bye.
So this is session 2, where we're going to be teaching you how to use your self-monitoring blood pressure device. When you come to the health district, you're going to receive this self-monitoring device. It's very simple to use, but we're going to explain each step.
So as you can see, there's an adjustable Velcro, and we want it to be nice and snug on her arm. As she puts it on her arm, we want to make note that it's aligned with her forearm, as you can see. Then, all you have to do is press the start button, and it will start taking your blood pressure. So some key points to note is we want to refrain from eating before. We want to sit nice and relaxed and not have our legs crossed. We want to keep your arm at heart level, as she is, and we want to refrain from talking while taking your blood pressure. And as we noted before, it should feel nice and snug on the arm, and we can adjust it as so with the Velcro. So when you come and pick up your blood pressure monitor at the health district, you will receive a paper with you so you can keep a record of your blood pressure readings. And there you go, we can see her
The
reading.
systolic number, which we talked about earlier, so the top number over the diastolic, which is the bottom number, and then you could just track that in your log.
So now's a great time to practice using your self-monitoring blood pressure device.
So that's going to be it for session 2.
We'll see you back at session 3, where we're going to be talking about lifestyle modifications. Hi everyone, welcome back to the Self-Measured Blood Pressure program.
This is session 3, and today we're going to be talking about lifestyle modifications. So one of the ways that we can lower your blood pressure is by identifying and maintaining a healthy weight. So first we can measure your BMI, so that stands for Body Mass Index, and it is the percentage of body mass to height. It's important to note that sometimes a person's BMI might not be the best indicator of a healthy weight because it does not consider the weight of muscle. So on this chart you can see that a BMI under 18.5 is underweight, a BMI between 18.5 to 25 indicates a normal weight, a BMI between 25 and 30 indicates being overweight, and a BMI at 30 and above indicates obesity. So next we can make some lifestyle changes, including diet and exercise, but we're going to talk about this more later in this session. Next is the waist-hip ratio. So this is measured by measuring your natural waistline as well as measuring your hips. This is going to be the fullest part of your hips. Then you will need to divide the waist circumference by the hip circumference. A healthy ratio is different for men and women. Anything less than 0.9 is going to be healthy for a man, and then anything between 0.9 and 0.99 is overweight, and then anything greater than 0.99 is obesity. But for a woman, anything less than 0.8 is healthy, anything between 0.8 and 0.84 is overweight, and anything greater than 0.85 is going to indicate obesity.
Okay, another way to lower your blood pressure is through physical activity. According to the CDC, regular physical activity helps improve your overall health and fitness and reduces your risk for many chronic diseases. Without physical activity, you're more at risk for hypertension, diabetes, and heart disease. Activity is good for physical health and mental health, as it lowers your blood pressure, strengthens muscle, improves mood, as well as decreases stress. However, we know that there are some barriers that make it hard to keep up with regular physical activity, such as lack of time, with jobs, kids, busy schedule, life in general, as well as lack of knowledge, as not everyone knows how much of what exercise to do. Pinterest is a great way to look up exercises and get some ideas. You typically want 150 minutes a week of moderate aerobic exercise. So if we break that down, it'd be 30 minutes of exercise 5 times in a week. Examples of this can be walking, riding a bike, walking a dog, gardening. 2 times a week of muscle strengthening is also encouraged. Examples are push-ups, lifting weights, climbing the stairs, yoga. The main focus with this type of exercise is making your muscles work harder than usual. Lack of motivation can also be a factor, as it can be difficult to get into a routine. Carve out a time each week and plan ahead. Sticking to a routine will help with this. It takes 2 weeks to make a habit. Some tips would be exercise with a friend or a pet, stretch before and after exercise. Don't push yourself too far. A little bit every day will add up, and don't be afraid to take a rest day.
So healthy eating is another way that we can work to lower your blood pressure. So calories are not the fundamental idea of nutrition, but instead it's a well-balanced diet with exercise that we want to focus on. So poor food choices include fatty, greasy, high sugar, or high sodium foods such as fast food, white bread, potato chips, coffee creamer, soda and diet soda, sweetened breakfast cereals, high sugar desserts, and French fries. So the DASH diet, or the dietary approaches to stop hypertension, focuses on fruits and vegetables, whole grains, and lean meats. And it says to have no more than 2,300 grams, or 1 teaspoon, of salt per day. This diet is low in red meat, salt, added sugars, and fat. So this diet also raises HDL, which is the good cholesterol, whereas exercise decreases LDL, which is the bad cholesterol.
So now's a great time to practice using your self-monitoring blood pressure device.
So that's the end of session 3, so we'll see you next time for session 4, where we're going to talk about medications used to control high blood pressure.
Hi everyone, this is going to be session 4, where we're going to be discussing medications to lower your blood pressure.
So there are 3 different types of medications that we're going to be talking about today. The first is diuretics. So this type of medication helps remove excess fluid from your body, therefore lowering your blood pressure. So a common diuretic that you might be prescribed is Lasix or furosemide. Next is beta blockers. So this medication slows and strengthens your heart, which in turn lowers your blood pressure. So two common examples are atenolol and metoprolol. Next is ACE inhibitors. So this medication will dilate or widen your blood vessels, making it easier for blood to flow through your body, and this is going to lower your blood pressure. So two common examples are captopril and lisinopril.
Alright, so let's talk about the treatment goal, which is to maintain a normal blood pressure reading. As discussed in previous sessions, it's less than 120 for your top number and less than 80 for your bottom number. Coexisting conditions that put you at risk are diabetes, obesity, sleep apnea, kidney disease, thyroid problems, the birth control pill, decongestants, over-the-counter pain relievers, as well as illegal drugs. So now's a great time to practice using your self-monitoring blood pressure device. So that concludes session 4.
And next time in session 5, we're going to be talking about adherence to high blood pressure therapy.
Welcome back. This is session 5, where we are going to be discussing adherence to high blood pressure therapy.
So it's very important to make sure to take your blood pressure medication as prescribed. And if you have any questions, don't be afraid to reach out to your primary care provider or your local health district. So some resources and support. So like I said, your local health district, your primary care provider, and there is a Facebook support group that you can join where everyone is supporting each other on their journey to lower their blood pressure.
So now's a great time to practice using your self-monitoring blood pressure device.
So that's it for session 5.
And when we come back for session 6, we're going to be discussing hypertensive crisis.
Welcome back. This is session 6, and we're going to be talking about hypertensive crisis.
Okay, so let's discuss what a hypertensive crisis is. Hypertensive crisis can be defined as an acute, marked elevation in blood pressure that is associated with signs of target organ damage. So some signs and symptoms include severe chest pain, severe headache accompanied by confusion and blurred vision, nausea and vomiting, severe anxiety, shortness of breath, and can also be unresponsiveness. So what should you do? You should go to the nearest emergency room. So now's a great time to practice using your self-monitoring blood pressure device.
So that concludes the self-measured blood pressure program. Thank you so much for watching, and we hope that you learned a lot about your blood pressure and how to manage it.
And remember, if you have any questions, don't hesitate and reach out to your local health department.